Good morning, Queensland. Now we're going to do the weather update first and the tropical cyclone watch, and then we will be discussing COVID and the plans for the start of the school year. So first of all, the Maryborough flood is expected to peak on Sunday evening. We're expecting it to reach about 10.5 metres. I want to thank all the agencies that have been out there helping, and there's door knocking underway, and at this stage we're expecting around 80 homes to be impacted. Can I thank our emergency services personnel for the extraordinary job that they have been doing over the last 24 hours. People have been rescued. They've been in constant contact with people that have been isolated in their vehicles. Another message, please, if it's flooded, forget it. The State Disaster Coordinator will discuss in more detail, but we do have concerns for the missing 14-year-old girl at the moment, and our thoughts are with the family at this stage. Pole Air is in assistance. They've got 8 specialist police out there also trying to assist. Can I thank the councils for all the work that they have been doing, and we've had an update from the Bureau, and we do expect the weather conditions to ease now, which is great news, but that unexpected rain that fell in that catchment area over that 24 hours was absolutely unprecedented. And I want to thank our police, our SES, all the frontline staff out there, the councils, all the government agencies that have just been doing an extraordinary job stepping up during this particular point in time. I've also had contact with the Prime Minister this morning. I want to thank him. He's prepared to activate any disaster relief that is needed for those communities, and we'll be putting in place those measures to make sure that communities can recover as quickly as possible. Finally, we had a briefing from the Bureau that we're expecting that the low will transform into a tropical cyclone, expected to cross the coast at 4 a.m. on Monday. It should be crossing between Cowan and Lockhart River. All of our agencies are very well prepared, and our local disaster management districts are very well prepared up there at the moment. We're expecting it to cross as a Category 1 and then cross just south of Arakoon into the Cape as well. So we'll be watching that very closely, and we're expecting that cyclone to be named Tropical Cyclone Tiffany later this afternoon. So to all the residents in those areas, please be on the lookout. I know that they know how to deal with these events. They're very well prepared, and we'll be keeping a very close eye on that. But I'll hand over to the State Disaster Coordinator, and then we've got Emergency Services, Mike Wassing to talk, and then we'll go into COVID. Thanks. Thanks, Steve.
Thank you, Premier. I might start with yesterday. We saw a very high-intensity operational response in the area from Bundaberg to Kilcoy, which was the area that we had to operate, and we had multiple responses across all that area. In the end, we had 16 tasks that required air support, and 11 people were transported by air, and all of those persons are well. In the end, we have had one confirmed fatality that was reported yesterday, and of course today we are still searching for the missing 14-year-old teenager, and I'll come back to that. We are seeing multiple road closures across that area. That is rapidly changing. There are still areas that we can't access. For instance, in the Kilkeven area, it is a very difficult area to access. So the advice, as yesterday, is please, before you travel in the area that has been flooding, check with the Department of Transport and Main Roads website or their call line, and just make sure whether it's safe to go. And the advice is still for people in those areas affected by the flooding, don't go out unless you absolutely have to. If it's flooded, forget it. We had to take action against a person in Bundaberg yesterday who had gone past a road closure sign and entered into water, had to be assisted, and that person was issued with a traffic infringement notice. So as well as putting yourself at risk and as well as putting our emergency services at risk, there are consequences for that type of behaviour, and simply we do not need it at the moment. I mentioned the missing 14-year-old at Boobajan. We have very grave fears for this young lady. We have deployed Pol Air and we have specialist water police and dive squad members on the ground, as well as SES and other emergency services. This is a very, very difficult environment. We are unable to get in there and conduct that search appropriately at the moment. It's going to take some time for us to do that. We will keep you updated about that, and our thoughts are with her family. We've seen a large number of jobs across the area. So in the Maryborough area, 177 requests for assistance in relation to people at risk. I'm happy to say we have no persons that are currently unaccounted for. We do have numbers of people that are currently isolated, and I'll let Acting Commissioner Wassing talk about the rescues and the jobs that have happened in that area in the past 24 hours and are continuing. Our focus at the moment is on Maryborough. We're expecting a peak of 10.5 metres this evening in Maryborough. We are well prepared for that. We understand it's something in the order of 80 residences and other businesses that will be impacted. There's a temporary levy in place which is operating effectively, and we are looking at issues around resupply and making sure that everyone is accounted for. So door knocking is underway. We're using emergency alerts. So please look out for your neighbours, make sure you're connected, understand what's happening. But as I said, we are well prepared for that. Similarly, for the cyclone that we are expecting to form in the coming days, preparations are well in play for that. All the emergency services have pre-deployed that need to. Our district disaster coordination systems are in place, and we're confident that we can get through that well. Again, our community has to listen to the messaging that will come out about that. Thank you. I'll hand over to Mike.
Thanks, Mike.
Thank you, Steve. I'll also start with the Gympie Maryborough flood environment. That's obviously our main focus again today. Yesterday we had 136 QFES personnel, swiftwater rescue technicians, state emergency service personnel, as well as Rural Fire Service volunteers doing door knocking in that area. We've also today will have another 87 personnel operating in the front line there. We've had 51 water-related incidents and 9 people rescued. We don't have any more rescues. We do have 13 people in 3 locations that remain isolated, and we're in close contact with those families, and we'll be working with them today with respect to whether we bring them out through floodwaters with our swiftwater rescue technicians or state emergency service workers and volunteers, or whether we just wait for the waters to reside. We've had 155 SES tasks, and we've still got 28 remaining, but they will be tidied up today. And as the State Disaster Coordinator has just indicated, our main focus today is to support the local council and local community with respect to Maryborough and the flood operations in Maryborough, and then the subsequent clean-up, and working with, again, the local community with respect to that over coming days. I do want to remind people about the dangers of floodwaters. We've had the shark in the park, we've got contaminated water, you've seen what can occur with roads in the local areas and how dangerous that is, albeit that the rain has stopped. The risk remains, and we really want to keep people out there and allow emergency service workers and our people to continue to work with the local communities and minimise any further impact associated with that, and that's why we have so many people still out there. So if you can just avoid the area, and we're always very conscious that we're very aware that many people have also really helped out, particularly yesterday during the peak of some of these flood operations. We do implore people, if you're looking to do self-rescue or help out others, to really assess the conditions and make sure that it is safe to do so, that you don't end up getting in a situation where you also have to be rescued. With respect to far north and the cyclone preparations, I'm very comfortable with our level of preparation there with the local communities. We've pre-deployed a range of capabilities to Cooktown and even into the Gulf, acknowledging the crossing of the tropical cyclone or the low pressure system early Monday morning, and we're well prepared there with the local councils and local communities also for any event that may occur. We still have 15 personnel from Swiftwater Rescue Technicians, Fire Rescue and SES still helping out in our New South Wales flood operations, and they'll be returning later on this week as well. Thank you. Happy to take any questions.
No questions?
Thank you.
All right, we'll just bring the Chief Health Officer in. Thanks.
Thank you.
Thanks,
Premier,
Mike.
did you want to do questions on flood? Has anyone got questions, or did you want to get to
We're going to straight to COVID. If you've got any questions on...
No, there's no questions from mine.
No? Okay. All right, just let everyone else come in. All right, got a few things to cover today. We had our Queensland Disaster Management Group meeting this morning, which was ministers, director-generals, talking about a range of issues in relation to this current wave. So let me say that today we have 18,000 new cases. Now 4,320 of those are basically people who have registered, who have detected a positive rat test at home. You would have seen big numbers in Victoria for exactly the same reason the other day. We now have 80,563 active cases, 402 people are in hospital, 22 in ICU, 5 ventilated. The Chief Health Officer will talk a little bit more detail about those. 37,951 tests were done in the last 24 hours, and our vaccine coverage is 91.10%, at least one dose, and 87.67 are fully vaccinated. Boosters are 695,575. That's Queensland and Commonwealth data together. So that's 45% of eligible persons are getting boosted. So if you are due for your booster, please come forward and get that. We've had roughly 230,000 rapid antigen tests have been deployed to our clinic so far. So that's great to see that constant stream of the rapid antigen tests are coming in. And of course, tomorrow, in good news, our vaccines kick off for our 5 to 11-year-olds. So if you have a primary school age student between 5 and 11, please go onto the Queensland Health website and book your child in for a vaccine, or go to your local GP, or go to your local pharmacy. There are a range of places you can get your children vaccinated. Now, I want to talk to you about the school year, and let me explain to you very clearly why we have made these decisions that we are taking today. The projections are at the moment, and modelling can change, but the projections are at the moment that New South Wales and Victoria will reach their peaks before Queensland. Queensland is expected to reach their peak during the last week of January and the first week of February. Therefore, it is not desirable to have our children back starting school during the peak of this wave. So the decisions that we have taken today will enable children to still get their full learning, but it will mean that parents can be confident that their children will not be going to school during the peak of this wave. So we will be starting the school year. It will be moving from Monday, January 24th to Monday, February the 7th. This is a delay, but it is a necessary delay because of the wave that Queensland will be experiencing. Now, our Year 11s and 12s, we know that this is a very important time for them, so they will commence remote learning from Monday the 31st of January. So for that week, they will start commencing remote learning. Then what we'll be doing is we will be extending, not for the Year 11s and 12s when they finish, but for the remaining school cohort, there will be an extra week of school at the end of the year in December, which means that school will end not on Friday the 9th of December, but it will end on Friday, December the 16th. And as I said to you, this is because we are expecting the peak of this wave during this particular point in time, the end of January, early February. Now, our schools will be open for vulnerable children and children of essential workers, as we previously have put in place during COVID, because it is absolutely critical that during this time that our men and women who are working in critical industries can still go to work. And remember, during the start of this pandemic, this is exactly the processes we put in place. So this is going to be a tough time of year for a lot of people, and I thank them for their patience and their understanding of the decisions that we have had to take in the best interests of the community. Also too, it allows more time for the children to be vaccinated as well, And as I said, please book your child to get vaccinated. It is not mandatory, but you'll hear from the Chief Health Officer. We are encouraging our children to be vaccinated. So I might get the Minister to talk a little bit more about that, and then, I'll get the Chief Health Officer to give the COVID update, and the Minister will talk a little bit more about the school year, and then we will talk about some other decisions out of the Queensland Disaster Management Committee that the Health Minister and I will address. Thank you.
Thank you very much, Premier. So today we have exactly 18,000 new cases to report, and this includes 4,320 cases that have been reported through our rapid antigen test registration page by people who've done rapid antigen tests on themselves. And this is fantastic to get so many already entering their data into our system since just midday yesterday. The reason this is important is twofold. One, it gives us some idea of the true number of people out there testing positive, not those that are being tested in pathology laboratories, as well as those that are testing themselves. But it's also important because it will enable us to put them into our care systems as we move forward. And I just want to make a brief comment. If you've had a PCR test done in a laboratory, you do not need to enter the information through the web page, the Queensland Health web page of your RAT result. If you've had both tests, it's not necessary to do that. We currently have nominally 80,563 cases, but we know it's substantially more. We know there are a lot of people out there who are either testing themselves at home or who are simply having symptoms and not testing, or who have mild symptoms and don't recognise that they have COVID. There are a substantial number of those as well, and it's very hard to quantify how big that group is. So there are a substantial number of people in the Queensland community with COVID-19 as we speak, and that's exactly what we expected, and that's exactly what is necessary in order for this virus ultimately to become endemic in the community. That is absolutely critical. It has to happen this way. But the next few weeks will be a challenge, particularly on our healthcare system. If the current situation in hospitals are that there are still relatively small numbers. So we have 22 people in our intensive care units, of whom 5 are ventilated. Although our intensive care doctors do tell me that the patients that are not ventilated are somewhat sicker than they had been in previous times. There are still, at this stage, only 380 cases in hospital requiring treatment for COVID-19, which on the scale of Queensland Health is a relatively small number. But I have an important message, not just for the community, but specifically for those in the healthcare sector. The projections are that the number of people accessing healthcare or in the hospital system will escalate substantially from about a week from now, and then it will continue to rise up until the beginning of February, that first week of February. So these numbers are, based on the projections, which I believe are credible, which appear relatively small at the moment, we expect that there will be a substantial increase probably from about a week from now, and my colleagues in hospital system need to be prepared for that. Recalling that most of the people that we have seen so far with this infection have been young, and so they're getting mild symptoms, but we know that the virus will be spreading into the older age groups. And I particularly implore those people who are entitled to receive the 3rd dose of vaccine, that booster, that is, they've had their 2nd dose 4 months ago or more, please get your booster now. It will protect you from hospitalisation and severe disease. There's good evidence for that. So please, if anybody who is eligible, if it's 4 months since your 2nd dose of vaccine, please get that booster. If it's less than 4 months, you're probably still getting good protection anyway. So that's particularly for the younger age group who might have only had it, say, a couple of months ago. We have 24,919 patients receiving COVID care at home, and 15,894 public COVID tests performed yesterday. 91.1% of the 16-plus population has received one dose, and 87.6% has received 2 doses. Thank you very much. I'll hand you over to the Education Minister.
Thank you and good morning. As the Premier said, we will be delaying the start of the school year for 2022, and we will move that start date to February the 7th by 2 weeks. The first week is a disrupted week anyway, as we have the Australia Day public holiday in the middle. So there's 4 days in the first week, and then of course the second week. We believe this is a common sense approach. We would love nothing more but to have had face-to-face learning, but unfortunately we will be facing a peak with the Omicron virus, and it is going to have a significant impact from the health advice on numbers, and not only that, but also allows more time for children aged 5 to 11 to be vaccinated, and as we know, the good news is that that can start tomorrow. Can I say that we want to give parents as much certainty as possible, and that's why we've taken this decision. We know that the year is going to be disrupted when we start schooling due to obviously staff numbers who may be sick or may need to isolate, breakouts in schools, and we don't want to have a situation where parents are being told at the last minute their children won't be attending a particular school because we have to close it down. We thought to give certainty and to minimise the disruption as much as possible that we would delay the school start year to the 7th of February. This will impact all schools and sessional kindergarten from primary through to secondary, and including the non-government sector. Schools will remain open, as the Premier said, to children of essential workers, and obviously vulnerable children as well, and there will be definitions in relation to who fits that category, but largely our health workforce, policing, frontline workers, supermarket workers, workers that need to deliver essential goods and services, they will be part of the essential workers category. This delay to the school term will mean that there won't be any remote teaching being delivered during this time, except for year 11 and 12s. They will have access to remote learning from the 31st of January. That's in the first of the second week, 31st of January, the Monday, through that week. But of course we have excellent online materials that parents can use with their children on our Learning at Home website, and that information will be going out and it's being updated and will be provided so that parents who may want to take advantage of that will certainly be able to do so. We've been working very closely with the department and with health and other key stakeholders on plans and the scenarios for weeks and months in relation to this. This isn't something new that we have just started working on. We have been working on the modelling and on the scenarios and the updated health advice that we received because of the peak, because where Queensland will be placed, it will be right in the middle of our peak time. This decision was made by the Premier together with the Queensland Disaster Management Committee. We also have spoken to stakeholders. They are fully aware of the information that I'm providing with you today, and there will be briefing going out to teachers and schools as of today that is currently ready to go, and the information will be on our website, including frequently asked questions, which will be a great deal of information for students, parents and carers. Obviously the best thing to do is to get vaccinated, whether it's your first, second or your booster dose, particularly now that we have the 5 to 11-year-olds being able to receive their vaccinations at the same time. Our teachers and our staff in schools are highly skilled professionals in delivering curriculum, and they will be able to ensure that no child is disadvantaged. But as the Premier said, we will add a week at the end of the school year to make up any shortfall that comes about. Queensland students have been incredible and resilient during these times, and as we know down south in Victoria and New South Wales, Wales and the ACT, they spent all of the last term of school not at school. In fact, we were the only state where schools were open on the eastern seaboard there at one stage for the whole of the term. It's not an ideal situation, but obviously we want to ensure that as much as possible we can provide certainty. Schools are very flexible as well should the situation change, and we can alter, but we want to make sure that we give as much certainty as possible, and so this decision was made today. We're hoping that staffing will be at enough numbers that we can provide that supervision for children of essential workers and obviously vulnerable children, and we'll be making sure that, of course, our schools remain a safe and very caring environment for those students. So that's a decision that has been made, and all that information will be available on the Department of Education's website today, and we'll be providing stakeholders, parents, students and carers all that information as soon as possible today. Thank you.
So essentially it'll be an extension of their school holidays, that there will be no remote learning for anyone under grades 11 and 12 are in remote learning. So those other kids of essential workers, say they go to school, will they just be provided with, I guess, school care? There won't be any learning?
That's right. It will be the same as what we did during the lockdown periods, or the 3 weeks that we closed in 2020, where those essential worker children will be supervised, they will be taken care of. They can do some learning on the website, and the same as their kids at home. But that's right, it'll be skeleton staff providing students that are available there with the supervision and with the care that they require.
So they don't have to learn during this period. They can if they want, but essentially it's just an extension of the holidays to help us catch up.
That's right. It'll be pupil-free days for teachers. They will spend the first week probably preparing for their essential curriculum learnings that they will have to incorporate for the rest of the term. It's a great time for teachers then to be able to work out exactly how they will be delivering that. They'll be spending that first week from the 24th of January, particularly for year 11 and 12, in working out their remote learning for the 11 and 12 starting on Monday the 31st of January.
11 and 12, that's compulsory?
Yes, that will be compulsory. Well, they will do the remote learning, and the teachers can spend that week where they need a bit of time just to collate exactly the type of curriculum that they'll be delivering, but they're very professional. They will ensure that essential learning will be delivered during the time, and as the Premier has said, we can will be added on to the end of the school year at the end of the year.
Sorry, just with teachers, will they be forced to take annual leave, or they'll be paid?
No. These are pupil-free days, and they will be paid accordingly. And some of them will be working actually quite, hard, making sure that the remote learning provisions and the curriculum tools are all there, and they will be available. Of course, that's if they're well, and not obviously part of the peak of the COVID where they're not well.
Minister, there's no guarantee though that you won't have to extend this delayed opening, is there?
I don't think there's guarantees at the moment for anything, to be honest with you, but we want as much certainty as we can possibly provide, and we don't want parents having to have snap closure of schools because we don't have staff or because there's an outbreak. It's best that we look at this probably under the best health advice that we can get in the country, and it is that we will be at a peak here in Queensland. It's a bit of a different situation to other states and territories. We're taking that, we've been modelling this, we've been working on these scenarios for weeks and months, and we believe this is the best way going forward to give those parents at least the certainty that they need so they can make arrangements.
But the Littleys, 5 for 11-year-olds will only have one dose at that point, because it's 8 weeks for the second, so you'll still only have that one dose vaccination protection.
Yes, I think it's better for the health advice to give you that, but our understanding is even that one dose is a great step forward for those 5 to 11-year-olds, and that'll be a lot better, and it gives them more time to get that first dose in those first 2 weeks that school would normally have been acquired. And then we will look at working with health about rolling out, of course, the GPs, pharmacies and access to those 5 to 11-year-olds to get vaccinated, as they currently are booking, as the Premier has urged them to do so.
Just sorry, clarification, have we unvaccinated children are still welcome in the school system?
Yes.
Yeah.
It's not compulsory.
All right.
Okay, thank you.
Move on to the next issue now. Thank you. So the Health Minister is going to now give some more information, but we are now making some rule changes to ensure that our critical work can go ahead. So basically, people who work in power stations, who work in power stations, who work in our health services, our teachers, who work in our water, sewage supplies, resources, agriculture, fisheries. Essentially, we need to make sure that the food is getting to where it needs to go. We need to make sure that our freight and logistic operators can operate in our state. So out of our Queensland Disaster Management Committee meeting today, we now have some changes which will take effect from midday today, which will ensure that these workers who may be quarantining at home but have not tested positive in limited circumstances can still continue to go to work to perform these critical functions. We need to keep the lights on, we need to keep the water supply going, we need to keep sure our freight is moving, and we need to make sure that our food supplies are getting to the destinations it needs to go to. So I'll hand over to the Health Minister to outline this new policy and how it will impact these critical workers. Thanks.
Thank you, Premier. So, as we have done throughout this entire pandemic, we have to be agile to making sure that we've still got critical services operating. So, just as we've allowed freight operators to cross borders when we had our borders closed, and we've allowed certain workers to still go to work, we are taking that next stage in our plan, which is if you are a critical industry that we have identified in a list that we'll be releasing, and within that industry you identify critical essential workers. Now, just because you may work in that industry doesn't mean every single worker will be allowed to go to work. There'll be many, many staff that can still work from home, but where they need to come into the business and work face-to-face, they will be allowed to do so. Those businesses will have to submit to government the list of critical essential workers, as in the occupation of those workers. It doesn't need an approval process, and they do not need to wait until they've sent us that list to start operating it, because we know that timing is everything here. We have empty shelves in supermarkets right now because of the number of people in the community who are positive, but importantly, how many people are having to quarantine because they're close contact. If we look at this, for every one person in our household who's positive, there's likely to be 2-3 other people who are quarantining. So what we want to do is, if you are a critical essential worker identified by your employer, you will be allowed to go to work only if you are fully vaccinated. You must wear PPE, such as a mask, at all times while you're working. You must also travel to and from work in personal transport or other transport arranged potentially by your employer, but it's not public transport. You still have to do a day 6 test, and you are only allowed to leave quarantine for that purpose of going to work and going back home. You are not released from all quarantine. You are released from quarantine as a close contact just to go to work. This is if you are asymptomatic. If at any point you get any symptoms whatsoever, you cannot attend that workplace. The Premier has already touched on some of the industries, but the lists are health. Now, we already have this protocol in health, but we're extending this to all of health, so the private hospitals as well. Emergency services, including police, the resource sector, power and utilities, agriculture and fisheries production, freight and logistics, public transport, teachers, so that we can allow essential workers to still send their children to school, essential retail such as supermarkets and stores in remote locations and communities, because they may be the only store in that remote community, and major manufacturing, distribution and critical supply chains, for example, food and petrol. So this is to ensure that people can still stay safe and get access to essential services and goods, but also to continue to try to slow down the progress of this virus. So we will go live with this at midday today. We've been working with The sector, I may remember a few weeks ago, back in December, we talked about our plan for employers, and we talked about what is a close contact and the requirements around quarantine. We also talked about the importance of working with those essential service sectors to make sure we have business continuity. I know there'll be lots of questions out of this, and I know our Directors General are working with the sectors, and of course Health will provide as much clarity and support that they can. The Public Health Directive will be going live today to provide the specific requirements around that, but it is not a requirement to have a government department approve the list. As long as you are one of those industries and you can verify they are critical essential workers, you will be able to ask those workers to come to work. Now, we will expect that some situations of close contacts will need to still stay at home because they may be caring for a child who is positive, for example, or another vulnerable member. And I'm sure employers will be working with their staff to ensure that only those who are able to come to work, who meet the criteria, who are close contacts, come to work. I do also just want to mention very briefly, because we do talk about the 5 to 11-year-olds and the delay in the start of school so more children can get vaccinated. I have had confirmed that our paediatric vaccines have been delivered to all of our state vaccination clinics that are offering the 5 to 11 from Monday. So if you have a booking, the vaccine is there, and we encourage as many families to just keep checking the website. More bookings will become available, and also we will be doing walk-ins as well, but we do ask for people's patience and respect for the staff and volunteers who are manning those centres from tomorrow.
You said yesterday it was 5% of children had booked in.
Yeah.
Are you happy with those numbers?
Yeah, look, it's going up every day. So I think the figure I might have quoted yesterday was it had gone from about 17,000 to 23,000 between Wednesday and Friday. I think the figure I saw overnight was around 27,000 bookings. So we're seeing that go up every single day, and that's just the state clinics.
Is there any update? I know you were talking with the Premier about having schools available to give the vaccine to children.
Yeah, so there's some in far north Queensland. We've partnered with the Pharmacy Guild. They were doing this last year as well, where there isn't many pharmacies or GPs in those areas, that the pharmacists are taking that into their schools. So I think there's about half a dozen schools in far north Queensland which will be offering it on site, I think on the weekends. But as far as taking whole immunisation teams into the schools, we're not planning that yet, remembering that those programs are normally run by health workers, and right now we need our health workers in our hospitals.
On the teachers' essential workers category, is that including TAFE and early childhood?
It's kindergarten, as I understand, but not general childcare or TAFE. So it's just teachers at our schools at the moment. Thanks.
I think the Deputy Commissioner's got one issue.
Thank you, Premier. And I just want to really quickly talk about these things, masks. I think you've heard quite clearly here that what we're trying to do, particularly in the coming period, is slow down the spread of the virus as much as possible. One of the primary things that our community can do for us is to carry and wear your mask when you should. We're still handing out hundreds and hundreds of masks every day. Even when we were in lockdown, we were only handing out handfuls of masks. Now, yesterday we handed out 324. We had to issue 2 penalty infringement notices, and we had to arrest one person who just point blank refused to wear it and then committed other offences. That is really not good enough. We really need our community to carry and wear their masks when they should. Also, in our calls for service, we attended a business in central Queensland where the business owner wanted to debate the rights and wrongs of wearing masks. They didn't agree with it. After speaking to police, then agreed to wear the mask, so we didn't take action. That ties our resources up. Like any other agency where it's being impacted by the impact of the virus, we really need our community to start wearing and carrying their masks at all time. Can I just say this is not an option, it is mandated in these circumstances, and if we can't see increased compliance with this, we're going to have to take a stronger position on it. Thank you.
Premier, you were very clear the other day, saying just how important this next 6 weeks is going to be for us. I guess your message to kids now would be, yes, it's an extension of your holiday, but let's not all, we still need to try and contain what we're doing within that 2 weeks.
That's right, and I think people need to be very sensible about where they're going and what they're doing. But also too, it's very important our vulnerable community is looked after. So as I've said very clearly, if you're in that vulnerable category, please think about your movements, and for the next 4 weeks, restrict your movements so you can be protected during this period of time. So essentially, if you're in that vulnerable category, and I wouldn't be going out to many large-scale events if you're in that vulnerable category, and make sure you go and get your booster. So if you're due for your booster, go and get your booster.
And if you've just had an inquiry here, is it from someone with community sport delayed for kids as well, that's often related to schools, or what can we say around that?
We'll find that out for you.
Can you
Yeah.
make it clear to parents why
Yes.
the high school term had to be delayed as well as the primary school term?
Yeah, they both need to be delayed because Queensland will be facing its biggest test over the next 4 weeks. The peak will be in the last week of January to the first week of February. During that period of time, parents would not have sent their children to school. It is sensible, it is logical to delay the start of the school year so children can be safe, children can get vaccinated, and families can be safe. And during this particular period of time, our health professionals will be put to the test. And can I thank everybody who is carrying out all of their duties at the moment on our front line. Thank you, thank you, thank you for the work that you are doing in protecting this state.
Premier, just with the changes that we've just been made, that you've just announced, obviously, from midday today.
Yes.
And just on what the Health Minister was saying, would that now free up some of those healthcare workers that may have been in? And
It will.
If you look at it now, would the schools maybe work in the next few weeks to do those mass hubs if we free up some workers?
Schools to do the math. What do you?
To do the vaccine for the kids. The Health Minister
Yeah.
saying we can't take the...
Look, at the moment, we're really encouraging our parents to take your children to the vaccination hubs or to your local GP or your local pharmacy. And as the Health Minister said, where there are no health professionals around, then they will be going into some schools, especially in the far north. But our health workers are needed on the front line. They're doing boosters at the moment, they're doing children's vaccine, they're doing testing, they're handing out the rapid antigen tests, they're looking after people in hospitals. This wave is going to get worse, it's not going to get better. So the next few weeks are very, very critical for this state.
The modelling you mentioned earlier around the peak being last week, January 1st of February, do you have the numbers of how many people are expected to have?
Not at this stage, but it is going to be a large number. Yep. We're working through all of those issues at the moment, and it's going to be it's going to happen across the nation, and we are essentially 2 weeks behind New South Wales and Victoria, essentially.
Premier, I've had a lot of businesses, saying it's basically a pseudo lockdown. The lockdown you're having when you don't have one. What have you got to say about that?
Look, we have over the last 2 years, the economy has been able to function here in Queensland, and what we are seeing from this wave is that in the vast majority of cases, people are not getting severe illness. But what we want to prevent is our elderly ending up in ICU, and that is why we are asking people to wear their masks. We're not going to stop this virus, we want to slow this virus down. And in relation to businesses, what I say there is that, unfortunately, if your workforce is sick, they need to stay home and recover. But it's usually people are sick for about 3 to 7 days, and after 7 days they can go back to work. So you will have a rolling wave of people coming and going back to work.
Perhaps a question for the Treasurer.
Yeah, sure.
You all talked about the need for people to stay home, particularly pregnant women, elderly people who are vulnerable. Can you offer some further advice to those people who are perhaps essential workers that have to go out daily? Should they be worried or...
What I would say is to those people who are particularly vulnerable, particularly those who have not received that third dose of vaccine. That third dose of vaccine is critical, that they should be avoiding crowds. That's really what I'm saying. Focus on the vulnerable, including, I would include pregnant women in that group. As we've said, we're not going to stop this virus. We're not going to stop the pandemic. All we are trying to do is to slow it down, to buy time, particularly to give people, the vulnerable, an opportunity to get that third dose. And that we know will keep people out of hospital, will keep people out of intensive care. So the measures we have are to slow this virus down. Obviously the mask wearing, the vaccination, including particularly the third dose in the vulnerable group. And the other key measures are quarantine and isolation. Isolation and quarantine, just so everyone understands the distinction between those two concepts. And sometimes they do get muddled. Isolation refers to what we're doing with people who have the virus. That's the single most important thing. So if you're infected with the virus, you need to isolate for 7 days. That's isolation. Quarantine is what we're doing with the close contacts of those who have the virus, of those who are known to have the virus. And we have redefined those close contacts as people who are living with a known case. So that those people generally are asked to quarantine for 7 days with a negative RAT test or PCR on day 6. Now, with some exceptions, notably in healthcare and these very other essential areas, using strict criteria, these people who are in quarantine, not in isolation, in quarantine, may be able to go to work using their own transport, wearing a mask, travelling home, etc. But it's a very narrow group of people. These are the measures that will slow the virus down and enable the healthcare system to work and to continue to function effectively. It'll be what we are looking at now very closely, and what we'll be reporting on daily are these hospitalisation rates. The projections we have been given, and I think they're credible, is that the number of hospitalisations will increase probably sometime around significantly from about 7 days from now. Now, if a lot of people go out and get the third dose now, we don't know, maybe that will change what the impact of the virus. We don't know. This modelling was done not assuming the existence of the third dose. So maybe that will make a difference, and we'll see in the next week or so. But at this stage, so this is a message to my colleagues in health. We are projecting in about 7 days we won't be talking the small number of people in hospital anymore.
We've talked about it before, especially the Health Minister has said that and the Premier, if we're unwell, we stay home. Just looking at those numbers, I think it was 402 today. It's 60 up from yesterday, thereabouts, so it is climbing. Out of those people that are in hospital today, surely some of those that are amongst it need to hear the harsh realities that perhaps they don't need to be in hospital. Perhaps that they've admitted themselves. No.
The people that are in hospital now need to be in hospital. I have 380 cases. 380 cases in hospital, and 22 in intensive care.
So we're already at 100. Are we looking at?
No, that's by Queensland Health standards, that's a small number. So no, yes, we're talking in the thousands. That's what we're trying. And I've said that before. What I'm saying is that we expect an escalation from about a week. That's the projection. If it doesn't happen because of the boostering, which I can't emphasise enough how critical that is, particularly in those people who are likely to be admitted to hospital. It's generally the more vulnerable. It's people. Most of the people that are being admitted to hospital are over the age of 50 or 60. So anyone over the age of 50 or 60 should have got their booster by now. If you haven't, you really need to go out there and get it. And obviously, people in intensive care, many of them have significant underlying medical problems. Obviously, they need to have the third dose. Not that many people that, from what I've seen the data on intensive care, I don't know that I've seen any that have had 3 doses, but it's very early, so I don't want to overstate that. I don't think I've seen any. I don't want to overstate that. It's probably.
It might seem a bit trite, but we just saw it on Friday. The QPAC contacted us about this wonderful show, American in Paris opening. They've sold 20 tickets since the messaging has been coming out this week. Put millions of dollars in. They're now confused about what to do. Like, if I'm double vaccinated, healthy, and wear my mask the whole time, am I safe to go?
If you're a young, healthy person who's double vaccinated wearing a mask, I think it's reasonable. If you're older, I think if I were going into a big theatre, I'd probably want to have third dose. If I were myself, I'm just turned 60, so I think if you're 60 or older, I would want to be absolutely sure I'd had my third dose before going into a crowded theatre.
You can still deliver though, can't you? Like, do they
I can. Well, but the vaccines are available. I think people are going out and getting them. I mean, we're seeing hundreds of thousands of people. Hundreds of thousands of Queenslanders have gone out and get them. If you're over 60, you've had 3 doses of vaccine, go to the theatre. That would be my advice.
Okay, last question. Right, good. Thanks, everyone. Thank you.
Is there a breakdown of the age group of people on intensive care and age group and